Major funding for the 2002 University of Washington Science Forum, Exploring Our World Large and Small, is brought to you by the University of Washington, Office of the Provost, College of Arts and Sciences, College of Engineering, School of Medicine, and the UW Alumni Association. With major funding from WRF Capital, the 2002 UW Science Forum is part of WRF Capital's 20th Anniversary Celebration Series. Additional support is provided by University Bookstore, Millstone Coffee, Dilettante Chocolates, and the University Inn.
Thank you all for taking the time, especially out of your busy work week, to come to the university to learn more about autism. Tonight I hope to leave you with a better understanding of what we know about the cause, the brain basis, and the treatment of this puzzling disorder. Now, the science that's required to understand something as complex as autism requires many different disciplines to come together and integrate the information across all of these disciplines. Each one of us brings a different perspective, a different technology, even a different language. And the challenge that is inherent in this need to integrate information across disciplines is one of the things that is most difficult about this task. It's also one of the most things that's exciting about it. In fact, at the University of Washington, we now have over 35 MD and PhD level scientists who are working together to try to understand autism, and scores of staff, graduate students, and undergraduates who are working on this problem. So I'd like to acknowledge my colleagues here in this effort. And I'd also like to acknowledge the tremendous support that we've received from Michael Gralnick, the director of the Center on Human Development and Disability, where many of these studies take place. Now, the primary goal of this research program is to try to prevent, treat, and possibly someday even cure autism. However, along the way, we also learn something about normal brain development. We come to discover what a remarkable learning device the human brain is. And we marvel at how easy it is for even a very young infant to be able to interpret a facial expression, to absorb language, to learn to relate to other children. And we see how difficult even the simplest of these tasks are for the child with autism. Now, I'd like to begin by briefly describing how we diagnose autism. And there's impairments in 3 domains. And the first domain is social interaction. Now, this has to do with difficulties in eye contact, in responding emotionally to other people in a normal way, in developing friendships. The second domain is that of language and communication. And here we're talking not only about the use of spoken words, but also the ability to communicate through nonverbal language, to be able to interpret facial expressions, body language, and emotional cues. And third, people with autism tend to engage in repetitive behaviors, and this can be manifested in a lot of different ways. It could be head banging, hand flapping, sometimes ritualistic motor behaviors, and often have preoccupations on certain topics or objects. Now, what I'd like to do is to put a human face to all these words, and I'd like to thank the parents who've agreed to let me show you this little video clip so you can see what a child with autism looks like.
We're planning up to 40 hours a week of home-based therapy.
Right now we do about 15 hours of the one-on-one with the tutor. 3 hours here, and on top of that we do the occupational therapy, physical therapy once a week for an hour. We do speech therapy for 2 hours.
Then he gets tired and he sort of withdraws a little bit and he does his own thing and he's done his homework and he's darn well going to be in his own world right now, and that's it, right? And that's sort of what he's doing now, I think. He's tipped off.
Now, the range of cognitive ability that we see associated with autism can often be in the mentally retarded range, but many people with autism are also intellectually gifted or have average IQs. Now, so far I've been focusing mainly on the impairments associated with autism, and I think it's also important to point out that many people with autism have remarkable gifts, and this can be in the area of music, art, mathematics. And let me just show you some of the beautiful art that has been created by people with autism. This is a illustration done by a local artist here in the Seattle community. Now, one of the startling facts is that the prevalence of autism is dramatically increasing. In fact, when I first started out in this field, this was 20 years ago, the prevalence estimates were about 4 to 5 per 10,000, whereas now our best estimates for classical autism are about 1 in 1,000. For the broader autistic spectrum, 1 in 500, or maybe even more frequent than that. So it's higher than deafness, than Down syndrome, than childhood cancer. No longer can we think of autism as a rare disorder. Now, is this a true increase in prevalence, or are we just getting better at diagnosis? Well, we clearly are getting better at diagnosis, especially children with mild impairments or children at younger ages. But the fact is we don't know the answer to that question, and the reason for that is that there simply have not been good epidemiological studies that have been conducted until very recently. The Center on Disease Control finally is starting to conduct studies where we are tracking what the prevalence of this disorder is. But certainly, this increased prevalence has led to a lot of media attention. And here we have a cover story in Newsweek, which was published 2 years ago. And then just 2 weeks ago, not to be outdone by Newsweek, Time also published a cover story on autism. So what do we know about the cause of autism? Well, we know that genes play an important role. And the best evidence of this comes from studies of twins. And what I have graphed here is the concordance rates. That is, if one child has autism, does the other child also have autism? For identical twins, these are twins that share the same genetic makeup, as compared to fraternal twins, where the twins, this would be like siblings. They share about half of the genetic makeup. And you can see this really big discrepancy between identical and fraternal twins in concordance rates. Now, if we increase the definition to include not just classical autism, but also the autistic spectrum disorders, what we find is that the concordance rate increases to about 70% in identical twins. And if we expand the definition even higher, so now we're considering not full-blown autism, but whether the twin has a social and or language impairment, we now see that identical twins have a concordance rate about 90%, as compared to fraternal twins about 15 to 20%. Now, these rates apply to what we call idiopathic autism. In other words, there's no known genetic cause for these cases in terms of identifying a specific gene. Now, for cases of idiopathic autism, this means that if they have one child with autism in the family, the chances of having a second child with autism are about 1 in 20. Now, if we look at the risk rates for second-degree relatives, so that would include aunts and uncles or cousins, we see a rapid fall-off in risk rates, about 1%. Now, the fact that we see this rapid fall-off from identical twins to second-degree relatives tells us that there must be multiple genes involved, and they're coming together in an unlucky combination for a given child to cause autism. So let's look at how that might occur. So here we have a hypothetical family where the Father is carrying 3 autism risk genes, but may be completely asymptomatic or may have a component of the syndrome. This father may be shy or may have a history of some kind of language delay. And the mother in this case is carrying 2 autism risk genes, but again does not have autism. And then in one case, the son has inherited all 5 risk genes and then has reached the threshold where autism occurs.